I'm Dr. Nikita Murthy, fertility specialist at Garbhagudi IVF Center. In today's video, I'll discuss about how to diagnose and what and all tests are done when you have PCOS, that is polycystic ovarian syndrome. Earlier this was called as polycystic ovarian disease, but now it is called as PCOS. So both of them are the same. So when you have PCOS, first of all, what and all symptoms do you have? So number one, you might have irregular cycles, or you might have cycles only when you take certain medicines, that is the hormonal tablets, withdrawal medication. Or you might have excessive facial hair growth, or a lot of pimples on your face, lot of acne on your face. So all these symptoms direct us towards a diagnosis of PCOS. So when you have these symptoms, usually when we suspect PCOS, there are certain blood tests and certain scan which has to be done. So coming to what and all blood tests are done, usually we do the hormonal test and the regular test. In the hormonal test, we do a panel of tests to know what is the severity, if you have PCOS or not, what is the severity and what sort of medicine should be given and how to manage this PCOS. So first being the FSH or the follicle stimulating hormone and the LH or the luteinizing hormone. So this is done on the second day or the third day of your periods. The baseline levels, that is if the LH is usually very high in PCOS patients, that is it might be, when we check the ratio, it might be 2:1 or 3:1, that is the LH to FSH ratio. So this is usually an indicator of PCOS. Second, doing a testosterone level. So testosterone or the male hormone usually is also produced in females but is present in very small quantities, whereas in PCOS the levels are very high, and that is what gives rise to the excessive facial hair growth and the acne. So those levels are also tested. And next being the AMH test, so an anti-Mullerian hormone which usually indicates how much is the egg reserve. So normal levels are anywhere between 1.5 to 3.5, and anything more than that indicates a higher egg reserve, which is usually seen in PCOS. Next, we do certain other hormonal tests, that is we check for the fasting insulin levels, which are usually high in case of PCOS. Other than that, what are the other blood tests which are done is that we usually check for a baseline blood count, that is to check your hemoglobin, and very important is to do the thyroid function test, that is the TSH, that is the thyroid stimulating hormone. So this test may be high in certain patients, okay, especially if there is a lot of obesity. If there is obesity with PCOS, thyroid levels also might be high, so it's very important to check these levels before starting any sort of fertility treatment. Along with that is the prolactin. So prolactin hormone also, if it is very high, can give rise to irregular cycles. So we need to differentiate between this condition and PCOS. So that is why prolactin hormones are also checked. Another very important test which is done is the to check your sugar levels. It can be done through a random blood sugar level or a HbA1c, which indicates how is your sugar control in the past 3 months. Or also it can be done with a OGTT, which is an oral glucose tolerance test. That is, after giving glucose water, after 2 hours, we usually check for the glucose levels, and if it is above a certain level, then we suspect that along with PCO, you might also have these metabolic conditions such as pre-diabetic level or a diabetic level, where you have to take medicines to decrease those sugar levels as well. Similarly, in PCOS patients, they are also at a risk of developing hyperlipidemia or high cholesterol levels. So fasting lipid profile is very much important in these set of patients as well. So these are all the blood tests or the hormone tests which are done in case of PCOS. Along with this, we do a scan to confirm the PCOS state. So in a scan, what do we look for? We are looking at the ovaries. So usually the size of the ovaries are larger in case of PCOS, that is it is bulkier. Along with that, lot of eggs can be seen. So lot of eggs meaning around 2 to 9 mm size of eggs are usually more than 15, more than 20. So this very bulky appearance of the ovaries, but a lot of eggs with a very thick stroma. So the middle part of the ovary is also very thickened. So all these features is point us towards a diagnosis of PCOS. So these are the various tests which are done in PCOS. So according to this test and the scan and the blood test, we will get to know what sort of treatment has to be given, and also how to manage your PCOS so that you can conceive either naturally or with higher treatments such as IUI or IVF. Thank you.